Hello, thank you for joining us for a community conversation on aging with security, resources for older adults. I'm State Representative Kate Lipper-Garabedian, representing the 32nd Middlesex District, which includes Melrose, Wakefield, and Malden. In this role and as House Vice Chair of the Joint Committee on Elder Affairs, I work closely with local and state nonprofit organizations and government agencies to help constituents access resources as needed. This legislative session, I introduced a bill that would direct the state treasurer to develop and periodically update model curricula to support older adults' financial literacy and stability in consultation with the Executive Office of Elder Affairs, the Massachusetts Councils on Aging, and AARP Massachusetts. Today's event can serve something of a jumpstart on that concept, with an opportunity for you to hear from experts on existing financial programs and resources that can help older adults as you prepare for your futures. We'll look at financial literacy, health insurance and Medicare, housing, food security, and estate planning. And I'm so pleased to host these community conversations to bring together diverse groups of people from a wide variety of backgrounds. With that, let's review our time together today. I'll start by introducing our esteemed presenters and provide some context regarding planning for financial security as we age. Then we'll benefit from high-level presentations from each expert who will highlight key resources and recommend next steps. We'll close with information about how to learn more and stay in touch. I'm so glad to be joined today by our five esteemed presenters, representing the State Treasurer's Office of Economic Empowerment, the Massachusetts Councils on Aging, LeadingAge Massachusetts, Mystic Valley Elder Services, and a trust and estates law firm. Thank you all for being here. I'm very much looking forward to your remarks. Adults 65 and older are the fastest growing age group in the United States. Ensuring that one can age with health, social, and economic needs met is critical to well-being and life outcomes. It is paramount that we take a comprehensive look at all factors that impact how one plans for aging with dignity and agency. By understanding the resources available to older adults in Massachusetts, I hope you'll feel empowered to protect your assets, avoid financial pitfalls, and navigate the complexities of retirement with confidence. Aging brings about new transitions that impact our financial well-being. As we age, we become mindful of saving for retirement, considering housing options, budgeting for healthcare expenses and food costs, and more. Ensuring you have planned for the decisions that come with aging not only provides peace of mind, but allows you to age securely and with dignity. Throughout my tenure as a state representative, and particularly in my role as Vice Chair of Elder Affairs, I have regularly interfaced with older adults in my district and across the Commonwealth. I'm mindful of the multifaceted challenges and decisions older adults face in terms of financial planning and all that it encompasses, ranging from healthcare costs, housing options, food and nutritional security, and asset protection. As I shared at the outset of today's program, this legislative session, I filed a bill that would direct the treasurer to develop model curricula to support older adults' financial literacy and stability. This concept actually originated from an office hours meeting with a constituent I had back in 2020. She had unexpectedly been laid off during the pandemic and thereafter decided to retire earlier than she otherwise would have. She met with me to describe how complex it was to navigate her retirement decisions, from financial planning to asset management to health insurance coverage. She was able to draw upon her financial resources and professional contacts to chart her new retirement path. But she was worried about how others with fewer resources or fewer professional contacts might handle such complicated matters. Her outreach has informed my work in this space ever since. And I have additionally been glad to attend various gatherings focused on promoting older adult financial and overall well-being, whether at my local councils on aging or the Somerville Cambridge Elder Services Forum, Future of Aging Forum this fall. So our goal today is to empower you with practical tools and resources that will help you make informed decisions and enhance your overall quality of life. By the end of these presentations, I hope you will feel more confident in managing your finances and have a better understanding of the resources available to you. So I'm now pleased to introduce our first presenter and get going. So we're going to start off with Michael McLeish from the Treasurer's Office of Economic Empowerment, where Michael is an outreach manager. OEE provides free financial education resources for older adults in Massachusetts. Topics covered include money management, fraud and scam prevention, banking, credit, savings, and financial recovery. Before joining OEE, Michael worked for a number of years in the Massachusetts State House as a legislative staffer. Michael, thank you so much for being with us today.
Thank you, Rep. Kate, and good afternoon, everyone. Once again, my name is Michael McLeish. I'm the Outreach Manager for the State Treasury's Office of Economic Empowerment, also known as OEE. Our office is dedicated to helping Massachusetts residents, including older adults, gain confidence and control over your finances. So we offer free resources that are easy to use and designed to fit your needs at this stage in life. So today we'll go over our new financial wellness website, which can help you reduce your financial stress, plan for the future, manage your finances more effectively. So we can move on to the next slide. So this slide features a short video that walks you through our website, which is masstreasury.enrich. It will show you how to navigate the site step by step and introduce you to tools and resources we've developed for you. Whether you're looking to improve your budgeting, learn more about retirement savings, or just reduce stress around money, this video will demonstrate how easy it is to get started and use the site to meet your needs. So you can press play.
Welcome to Enrich. This powerful financial education platform is now free to Massachusetts residents through the State Treasurer's Office of Economic Empowerment. Let's check it out. After creating your free account, take your first financial wellness checkup to get personalized recommendations and a plan to reach your goals. You can also find in-depth guides on topics you're interested in, from starting a business to owning a pet and much more. We're proud to add Enrich to the Treasury's suite of tools and programs to help people achieve their financial goals. To get started, visit masstreasury.enrich.org.
Thank you. And we can move on to the next slide. So as we mentioned in that short video, one of our most valuable tools on the platform is our financial wellness checkup. So this tool is designed to help you assess your current financial situation in a simple, clear way, identify areas where you might feel financial stress, and provide personalized recommendations to address them. And it allows you to update your checkup regularly so you can see how your financial wellness improves over time. So for older adults, this tool is especially helpful in understanding your financial standing as you prepare for or navigate retirement. It's a secure website, it's private, and it's tailored to your needs. Moving on to the next slide, we're talking about money mindfulness. Managing finances can sometimes feel overwhelming. And this section focuses on reducing that stress and improving your relationship with money. So here's what it offers. Short meditations, just 20 minutes each, that can help you cope with financial worries like budgeting, unexpected expenses, or retirement planning. There are also journaling prompts that let you reflect on topics like gratitude, financial confidence, and stress management in a private, secure space. So these tools are a gentle way to address financial stress and improve both your emotional and financial well-being. Moving on to the next slide, our interactive courses. So the platform offers 30 self-paced interactive courses on a variety of different financial topics. These courses are designed to meet you where you are and help you with the work toward your goals at your own pace. For example, these are courses on budgeting and saving, understanding Social Security and retirement planning, and managing healthcare costs or long-term care planning. Whatever situation fits your needs, the interactive courses will likely have a course for you to meet you at that point. So the course includes personalized action plans, certificate of completions, giving you a sense of accomplishments as you progress. Plus, you can compare your results with others to see how you're doing. So we encourage you to get started today. Everything we've discussed here is available at no cost to you. So to access these tools and resources, please visit masstreasury.enrich.org. If you have any questions or need assistance, you can contact us at empowerment@tre.state.ma.us. Thank you all for your time.
And thank you, Michael. It's really such an incredible resource that folks have here in Massachusetts. Obviously, today we're talking specifically about financial choices and decision-making as we age and for later life. But certainly anyone watching today may want to take a look because it sounds like there are some personalized options for anyone. So thank you. I'm now very excited to introduce Hayley Wood. Hayley serves as the Economic Security and Outreach Manager for the Massachusetts Councils on Aging, which provides support, training, and advocacy for the Councils on Aging all across Massachusetts. Hayley previously was the Director of Hadley Senior Services, an outreach coordinator at the East Hampton Council on Aging, and a care advisor at Highland Valley Elder Services. Hayley, thank you for joining us.
Thank you. Hi, everyone. I'm pleased to be here to share some information about resources for older adults and the way that, and specifically the way that councils on aging and the outreach coordinators that work in them can directly work with older adults and learn about resources that can be really important for their well-being. So in my role, I provide outreach coordinators at Councils on Aging with resources and support, and in so doing, hope that radiates out to the broader field of all older adults in the state. Next slide. Just a little bit of information about the Massachusetts Councils on Aging. MCOA is a private nonprofit membership organization, and it does receive a large percentage of its funding from the Executive Office of Elder Affairs, and it also administers EOEA funds to the Councils on Aging statewide through a competitive grant process. Most, but not all, Councils on Aging are situated and run within senior centers. There's a very large spectrum of Council on Aging and senior center styles, sizes, staff capacity in the state. And if you've seen one senior center, you've seen one senior center. So our goal is to make sure that the professional development opportunities for all senior center staff are robust and keeping pace with, the changing landscape of life. Shane, next slide. Oops, I think we're back one. Well, there are 351 municipalities in Massachusetts and 350 councils on aging. And the outreach coordinators at Councils on Aging provide social services support to residents. They work one-on-one with folks, and they connect older adult community members with benefits such as SNAP, Supplemental Nutrition Assistance Program, food assistance, other food security programs like brown bag groceries, home delivered meals, congregate meals, food pantries, and other food bank oriented programs that many regions have. They connect residents with home care options, which can be really important to being able to age in place for as long as possible. And many of them also are able to connect residents with Mass Health and to assess them for eligibility, which is really important and leads us into some of the health insurance options that I'll talk about a little later. Additionally, fuel assistance, that this time of year is a very important direct assistance to older adults who are financially eligible. Information about tax relief programs. All municipalities do offer some specifically designed tax abatements for older adult residents, as well as, and they can direct residents to home modification loans, another really important resource for making homes accessible long-term for people who are experiencing disabilities, many of those disabilities brought on by age, such as mobility issues. And people often don't know about these programs, and so outreach coordinators are a wonderful conduit for, rich local information about how to thrive at home. Next slide. Outreach coordinators at Councils on Aging routinely work with other employees in municipalities, and I want to mention this because often higher needs individuals come to the attention of staff members at Councils on Aging through their colleagues in municipalities. And I do really believe that this collegiality and the collaborative spirit in towns and cities is a really important ingredient in security overall. Referrals from first responders frequently lead the way and lead to important case management relationships with people. And not listed here, but often employed by cities and towns are social workers at the LICSW level who can work for health departments or be co-responders with police departments. They often work with outreach coordinators. Next. Many outreach coordinators at senior centers are SHINE counselors, and if a senior center or council on aging does not actually employ a staff member who's SHINE certified, there is a certification process, they will almost certainly have in place a volunteer who works year-round to assist Medicare enrollees with health insurance questions. SHINE services are always directed toward people who are on Medicare and also can assist people with establishing whether or not they might be eligible for mass health benefits and perhaps both. SHINE stands for Serving Health Insurance Needs for Everyone. Trained and certified SHINE counselors work in sites all over the state to provide expert assistance to Medicare enrollees and to support people who are planning to enroll and to understand the enrollment process, which is not exactly straightforward. Most councils on aging provide access to SHINE counselor volunteers year-round, and I want to mention too that Mass Options is a program within the Executive Office of Elder Affairs that can direct anyone to to a local SHINE counselor in their own region. All right, and okay, sure. The SHINE program is situated with the Executive Office of Elder Affairs, whose director is Cynthia Phillips. And there are 13 regional program directors of the SHINE program overall who manage all of the SHINE volunteer counselors and maintain certification standards and have offices at aging services access points. Education and trainings, this is important to be aware of. Councils on Aging frequently will host, say, Medicare 101 or any regular introduction to health insurance benefits and an introduction to the structure of Medicare, which again is complicated and unfortunately is not at all intuitive. So I would just want everyone to be aware that the EOEA's SHINE program offers trainings and the regional directors of SHINE programs offer trainings. It is not hard to find an expert who can talk at a senior center and give a great overview for participants there. SHINE counselors are particularly busy helping people on people during open enrollment. Open enrollment is an annual period of time, October 15th to December 7th. It's every year. And this is the time of year when Medicare enrollees have the option to change prescription drug and health insurance coverage. I want to go into a little bit more depth on this slide itself to point out a program called the Medicare Savings Program that used to be known as Senior Buy-in. Now the MSP acronym is what you're going to see everywhere, and it underwent a very important and significant change just this past March. Eligibility for this program no longer comes with an asset limit. It does have income limits, and it does have a gradation of benefits based on income thresholds that I've described in the bottom bullet of this slide. But enrollees in the Medicare Savings Program at the very least will have their Medicare Part B premium eliminated. That's $185 a month. Most people have that withdrawn automatically from their Social Security checks. I mean, think about how wonderful it is to have that restored. And many, many more people now than in the past are eligible for this. So this is one of the first things that any SHINE counselor nowadays will screen for, because as I said, the threshold has changed. Many more people are eligible, and this can be a significant help on a month-to-month basis. Not to mention it offers important benefits and help with prescription drug costs. Next. I want to point out this other program that's run by ASAPs. This is something that's known to outreach coordinators in senior centers, and I think the general public would be well advised to know more about it. It's money management programs that are housed within aging services access points. Usually there is a money management director, a paid staff member at an ASAP, who will manage a series of very well trained volunteers who can assist residents who are struggling with paying bills. This is one of the things that you may or may not be aware can kind of fall away. it can be hard to keep up with mail. Paying bills can become burdensome over time. I'm so pleased to learn from Michael about the OEE and the various financial literacy training that is now available. That dovetails beautifully with this particular program. But this program has a couple of different levels of assistance. Bill pay, the first one on the bullet point here, can only be one has the client receiving this service needs to voluntarily accept it. This cannot be thrust upon anyone. No one can make one do this. And it's a lighter level of assistance with bill paying, but the volunteers do not sign checks, but they will help sort out bills, create budgets, and meet with people monthly to just keep track of their finances and give them a hand. The representative payee program is a heavier level of assistance, and clients who receive this level of assistance need to have some kind of a referral from a medical or therapeutic professional. And they must have a diagnosis that states they are unable to pay bills. So for example, someone with a diagnosis of dementia would be an eligible person for this. But this is a really important program that, again, can really help people with aging in place and staying home, which is definitely the goal for most older adults in Massachusetts. Next slide. This table comes from a recent study called Living Below the Line, Economic Insecurity and Older Americans' Insecurity in Massachusetts. This was prepared by three scholars at UMass Boston, Jan Muchler, Nydia Velasco, Roldan, and Yanju Su. And I put this here to just illustrate the minimum amounts of money that are necessary to afford to live in Massachusetts for single people and for older adults. And it's important when you're looking at the totals on the and this is called the Elder Index, which is a tool that was developed to assess the affordability of living in states and in Massachusetts in particular. And I think, and it's easier for people who are living as a couple to afford to live than singles. And people who are particularly at risk for having difficulty affording to live are renters. In advance. And some of the key facts from that report, I think, are really important to be aware of, because although it's important to be aware of the resources and the tools, and there are many and more are coming all the time, I'm glad to say, the context of the specific situation in Massachusetts is also important to keep in mind, because there are some structural disadvantages economically that older adults are facing, and that we will all be facing. So I think it's really important, for example, to understand that nearly 300,000 Massachusetts single or coupled residents age 65 or older live with incomes below what it takes to cover essentials. I think another really stunning fact, I won't read all of these, is that more than half of single renters 65 and older do not bring in enough money to cover basic expenses. What this really points to me is that people who are in the position of renting need some extra attention, and our legislation needs to move in that direction. That's one of the reasons I'm particularly pleased that the Affordable Homes Act was passed last year. Next. So summing up, I just want to kind of bounce back to the role of outreach coordinators at senior centers, councils on aging. I do use those terms interchangeably. They are the best on-the-ground resource for older adults in communities. They provide one-on-one assistance. They frequently are able to provide some long-term case management, and they build relationships with residents that really matter. And they can, over time, introduce residents to a number of really important resources. We believe that the outreach coordinators spend more service hours on helping people with housing issues than anything else. And in fact, housing security is a big anxiety for many older adults and many people working in the field assisting them. So that continues to loom large, and we'll just continue to be working on increasing options for people to age in place. But there is a large number of resources that people that that professionals at Councils on Aging are able to efficiently suggest to older adults and help them gain, the goal of economic security long term. That's it.
Thank you, Hayley. Really helpful to hear from you. I know the legislature this fiscal year was pleased to increase the funding for councils on aging across the state in the formula that we use.
Indeed.
I'm struck also by the Elder Index, which demonstrates that healthcare, even for a healthy older adult, is the second largest amount of, the largest concept that in which people need to have money to cover. So I'm particularly eager to raise up and disseminate more information that you've shared around the SHINE counselors, because certainly the constituent who came forward to me described how challenging it was to understand Medicare and opting in or opting out of things and what was available to her. And so this is a really important resource that older adults throughout Massachusetts can, in addition to the OEE modules that I'm sure deal with, insurance coverage, SHINE counselors are also there to help folks with their health care decision making. So thank you for highlighting that, certainly. As we also saw from your Elder Index slide, the number one thing that folks need to save for is housing. And so I'm very glad today that we're going to be hearing from Elissa Sherman. Elissa is the president at LeadingAge Massachusetts, a trade association dedicated to supporting the work of not-for-profit aging service providers. Elissa holds a PhD in social policy and management and began her career at the Massachusetts State House as the research analyst for the Committee on Human Services and Elderly Affairs. She then served in the Executive Office of Elder Affairs before joining LeadingAge Massachusetts. And Elissa, we're really grateful today that you're here to talk with us about the issue of housing for older adults. So thank you for being here.
Thank you so much, Rep. Kate, for inviting me, and thank you so much for holding this really important conversation to really allow people to plan for their later years, which is so critically important. As you mentioned, just briefly, I'll share a little bit about LeadingAge Massachusetts. As Rep. Kate said, we're an association of not-for-profit providers of housing and services for older adults in Massachusetts. You can go to the next slide, Hayley. Our members as not-for-profits are all governed by volunteer boards of directors. Many have very, very deep roots in their communities. In fact, we have a lot of organizations that have been serving their communities for over 100 years. But as an association, our mission is, to expand the world of possibilities for aging, and that we're working to create a future where all older adults can live in age-friendly communities where and receive the services that they need when they need them in the place that they call home. So next slide. As Rep. Kate just mentioned, obviously one of the most critical aspects of security, really at any age, but certainly in our older years, is that of housing. How affordable is our housing? Can we afford to live where we're living? How accessible is it? Are we able to continue to participate in seeing the people and visiting the places that are most important to us with transportation? So the housing that we live in our later years is really one of the most important factors of our security. The vast majority of older adults in our country, this is a slide data from the Joint Center for Housing Studies at Harvard University. The vast majority, more than 3/4, do live in their own homes, either alone or with a spouse or with another family member in their own home. A much smaller proportion of older adults live either with other family members, and even a much smaller proportion of that actually live in some sort of group setting. Unfortunately, however, though, we know that about a third of all older adults are living in households that are considered to be cost burden, which means that they're paying at least 30% or more of their income towards their housing. And the numbers, unfortunately, keep growing every year of older adults that are cost burdened. And of those that are cost burdened, more than 50%. Over half of those are severely cost burdened, which means they're paying more than 50% of their income towards housing. Next slide. As Hayley indicated earlier when she was talking about the Elder Index, one of the specific problems in Massachusetts is the very, very high cost of housing. And there is unfortunately not enough affordable housing to meet the demand and certainly the numbers of individuals who would be eligible. However, a good thing, and you can go to the next, back there. I think, nope, next slide, sorry. Hayley also mentioned the very, very good news that our state, our leaders, both in the legislature and the administration, have recognized the critical importance of responding to the high cost of housing and passed this historic Affordable Homes Act, which is a $5.1 billion housing bond bill and inclusion of about 50 policies, all aimed at both expanding the supply of housing and trying to deal with the challenge of affordability. So that was really great news that was signed into law this year. So let me shift gears now and talk specifically about the different senior housing options that do exist for older adults here in Massachusetts. So there are, what we consider independent living, then housing options which provide additional supports such as assisted living, rest homes, and certainly nursing homes. And there are lots of different reasons for why older adults would want to decide to move into a senior living community. Some would move for financial reasons. As we said, they can't afford the situation that they're living in, especially if they are in a rental community, a rental apartment right now where the rent has continued to go up. Some might be for health reasons or functional reasons, and some certainly are for lifestyle or the desire to live in a community with others. We know, unfortunately, that loneliness is really has become an epidemic, and it is a tremendous concern. And so moving to a senior housing community is certainly can be an antidote to loneliness. So if you go to the next slide, let me talk a little bit about independent senior housing, which are communities really consisting of apartments, so rentals for either independent and sometimes they're considered congregate living for adults, usually age restricted, so usually a minimum age of somewhere between 55 or 62, depending on the type of property. But they really provide a secure residential environment, oftentimes a really wonderful community, but don't routinely provide the types of healthcare or staffing or services that you would see associated with an assisted living or another type of healthcare environment. However, many of them, they vary in terms of additional services and amenities that might be available. Some may have meal sites. Some have access to fitness or other community rooms and offer programming. Many do have service coordinators that are available on staff to be able to help access services in the community, such as connecting up with the aging service access points or helping to identify other benefits and services. Properties that are considered affordable have rental subsidies available for older adults that meet certain income limits, so that the goal is that they're not paying more than 30% of their income towards rent. These affordable properties include both public housing, which are either owned and managed through the local housing authorities. Either there's both state public housing and federal public housing. You can find out about these housing organizations through contacting your local housing authority. There are also privately owned affordable housing, which are owned and managed by many times nonprofit organizations, but that also have rental subsidy, again, to be able to subsidize the rent that the individual is paying. For those, an individual can contact the management of the local private organization directly. The councils on aging are also oftentimes a great source of finding out what affordable housing is available in their community. But one thing that's really important to know is that unfortunately many of these communities have very, very long waiting lists. And so it's important to explore, know what's available, and certainly apply as early as possible to get on a waiting list. Do you want to go to the next slide? Thanks. So assisted living, now we're kind of moving along, I would say, the continuum, and assisted living is really a housing option that I would say is really need-based. Individuals would be usually considering assisted living when they have need for assistance, oftentimes with activities of daily living, so bathing, dressing. They need reminders to take their medication, and they really want that 24-hour support, access to making sure there's, somebody is available 24 hours a day. So assisted living residences here in Massachusetts, again, are these 24-hour supportive communities that offer meals, staffing on the services that I indicated, all sorts of activities, and a community. So many of them are apartments, but they vary in terms of either studios or one-bedroom apartments. Most won't have a full kitchen, but may have a microwave and refrigerator because there's meals available at the community. Unfortunately, there's a challenge of affordability of assisted living residences. The average monthly cost here in Massachusetts is about $7,000, and the majority of communities are for individuals who can afford to pay privately. There are some communities that if someone's eligible for Medicaid, either through a group adult foster care or if they're part of PACE, that they might be eligible. Next slide. A similar type of community to assisted living, but slightly different, are called rest homes. These are also supportive housing environments that offer 24-hour support and activities of daily living, meals, medication management, activities. Generally, these are slightly more affordable than most assisted living. They tend not to be apartments. They're generally some older buildings, older communities, and many times smaller, but for that reason, they may be more affordable and another option. And they also are, there are some private, some subsidies available for those who are not able to pay privately. And finally, also in terms of healthcare, go on to the next slide. There's nursing home care, which again are really more healthcare environments. Many people may have experience with a nursing home as a short term following a hospitalization. They may go to a nursing home for short-term rehab covered by Medicare. In many cases, most people will go home following that back to wherever they were living. However, for some people who really need care over an extended period of time and really 24-hour kind of nursing supervision, they may end up staying in a nursing home for long-term care or certainly for at end of life. So nursing home care for those who can't afford are generally covered by Medicaid. So, and finally, I do want to mention an option that are called life plan communities, also referred to as continuing care retirement communities, which are communities that offer kind of a campus of different types of housing. Many people will move into an independent apartment, but also have access to either home care in the apartment, assisted living in many cases, or nursing care right there on the campus if they ever need it. And most people who choose to move to a life plan community are doing it because of the lifestyle. They have lots of different amenities, including different dining options and lifelong learning and all sorts of cultural and community events. But people would take advantage of that also in the ability and thinking about planning for the future in case they ever need, the additional level of care. These aren't just rental; they are available through. There's an entrance fee, which can be pretty substantial, but depending upon the contract, the entrance fees are often partially or not or completely refundable if at the time that a person leaves or passes away, in addition to a monthly fee. So that's just another option for people who are really thinking about planning for their future may consider. So next slide. So you can find a lot more information on our website about all the different options, housing options. Our website is www.leadingagema.org, and up, if you look at under consumer resources, there's a lot more information about all of these different communities and where you can get additional information. But I think most important is thinking about, planning and thinking about, understanding what the options are in your community so that you're not having to make decisions without all that information and planning. So thank you.
Thank you, Elissa. That's very helpful information about our housing options and the sort of continuum of care. We're going to be turning momentarily to a representative from one of our aging services access points. And that's also a good opportunity for me to also mention that for that large majority of older adults who continue to age at home, whether individually, with a spouse, with other family, we certainly have resources available for home care services. And we're going to hear about some of that in just a moment with respect to food and nutrition. I'd also just like to raise up not only the Affordable Homes Act that we passed this legislative session this year, but we also did the first reform in decades around our long-term care with provisions related to nursing homes and the nursing facilities, in terms of the workforce and quality and protections for residents, as well as some provisions around assisted living residences and providing more freedom to provide some of the health services there rather than requiring that residents go off-site for them. So also some important legislation that got to the finish line this session. So with that, I'm very pleased to introduce now Carla Matute. I'm sorry, Carla Matute, as someone whose last name is also a mouthful. I hope you'll forgive me. Carla is the Director of Nutrition at Mystic Valley Elder Services, which is one of our ASAPs and is an organization that partners with individuals, caregivers, support services, and the Executive Office of Elder Affairs to provide older adults and adults with disabilities with supportive and nutritional services. Carla oversees the programming that connects older adults with meal services and nutrition counseling to support a quality life. And again, we did see food show up as one of those costs that Hayley presented to us with respect to sort of the elder index and what folks need to be budgeting for. So Carla, thank you so much for joining us.
Thank you so much for having me today. I just wanted to give you guys a little bit of an insight into Mystic Valley. So we have been in the field since 1975, and our core mission is to support the right of older adults and adults living with disabilities to live independently with dignity in a setting of their choice. And today we're just going to be discussing combating food insecurity issues among older adults. Hayley, if you can go on to the next slide. So just to understand food insecurity in Massachusetts, so this is from Meals on Wheels of America, about 14% of older adults in Massachusetts are experiencing limited or uncertain access to adequate food. About 7% are experiencing reduced quality, variety, or desirability of diet. So understanding food insecurity. Food insecurity refers to the lack of consistent access to enough food for an active and healthy lifestyle. It encompasses both the availability and affordability of nutritious food options. And how this impacts older adults is that they're often facing unique challenges like we've discussed today, such as fixed incomes, health-related constraints, social isolation, which exacerbate the risk of food insecurity. Food insecurity can also lead to worsened health outcomes for older adults, increasing hospitalizations and healthcare costs. Just some stats, lower income adults with diabetes have a 27% higher rate of hospital admissions at the end of the month due to food insecurity, which is a really startling fact, is that people are being put at risk health-wise, not just for the fact that they can't access it, but they don't have it. Hayley, if you can move on to the next slide. So just to give you an overview a little bit on aging services access points. So really our role is connecting older adults to vital resources. I've been in the field about 10 years, and when I was an intake worker in the field, what I always explained to anyone I was going out to see was that even if an ASAP isn't your direct source for what you're looking for, we can give you the tools or resources to find the support that you need in the community. So I always encourage older adults, contact your local ASAP if you are trying to navigate through Aging Services, we are here to help you. We act as a local entry point for older adults and people with disabilities to access a range of supports and services, including nutrition, which I'll be talking about today, healthcare, social services, and we act as a bridge to connect older adults to these types of services and reports. And if we can move on to the next slide. So this is kind of more in my wheelhouse. So I'm the Director of Nutrition here at Mystic Valley Elder Services. So what we do is we manage the Meals on Wheels program. Meals on Wheels is a community-based service delivering nutritious meals directly to the home of older adults, ensuring they receive proper nutrition without needing to navigate food procurement independently. At the start of the Meals on Wheels program, really the goal was to serve homebound older adults, but that has changed drastically as the landscape of aging services has changed. Really, we're not just providing meals to people who aren't able to leave the house, we're providing meals to people who can't afford them otherwise. Typically available to seniors 60 and older, eligibility often considers factors like mobility, dietary needs, and difficulty affording food. Recent studies have shown that medically tailored meals lead to lower hospitalizations, ER and nursing home admissions. So through Meals on Wheels program, we not only provide a lunch meal, you know, your typical supper meal, which might be a sandwich or salad, soups, breakfast. We also offer medically tailored meals for people who have any dietary restrictions, diabetics, people with heart issues, kidney issues. We're really trying not just to provide people nourishment, but we're trying to provide the meals that can overall improve their quality of life and their health. Meals are designed to meet my dietary guidelines for seniors, like I said, with medically tailored meals available. If we can move on to the next slide. So another facet of our program is congregate meal program. So we've talked a little bit about this with the councils on aging earlier, but what we do is we offer older adults a location that they can come to meet with peers and enjoy a nutritious meal. We work in tandem with councils on aging, supportive housing sites, and we offer meal sites that are safe and accessible to older adults. And really, now that we have a new generation kind of aging into aging services, we're finding that not everyone has the ability, unfortunately, because some people are still having to work after retirement, to come to a congregate site and access a meal, and they can't guarantee that they can be home to receive a meal on wheel delivery. So what a lot of the Council on Aging and us have been working together is to create flexible options for people who are in need of affordable and nutritional food. So we have grab and go meals, where at some of our COA sites, we have meals that people are able to come in at the time they're able to and pick them up and take them. They don't have to remain and stay with us. We also work with Bread of Life here at Mystic Valley Elder Services and Spoonfuls to get meals delivered to supportive housing sites for people who aren't able to access transportation or have the mobility to go out to shop for themselves. And really what we're trying to combat with having these programs available is ensuring that, again, they have the access, but also trying to encourage older adults to come out of their home and meet in their communities. And the best part about it is if we can draw people in with a meal and a friendly smile, we also bring them to the resources that the COAs themselves offer. You know, sometimes it is a foot in the door for a lot of older adults just to, well, come check out the lunch program. And then while you're there, you can see what other supports and services are available. So it's really a great bridge. And we can progress on to the next slide. So another great benefit is the SNAP program, which we talked about a little bit earlier today. So just to give you an overview, SNAP provides financial assistance to low-income individuals and families, enabling them to purchase healthy food. It operates through an electronic benefits transfer system and allows easy access to funds at authorized retailers. So for eligibility criteria, there's a couple factors, including household income, size, and there are different considerations for older adults. And its impact on food insecurity. Enrollment in SNAP significantly alleviates food insecurity by providing an increased economic buffer, allowing older adults to buy nutritious food consistently, thus improving overall health outcomes. And again, we kind of know that when people have access to healthy, nutritious, and affordable food, that they have improved benefits for their health. There's financial relief and economic stability that SNAP provides. And what we're going to talk about a little bit later is how we can benefit from stacking benefits to kind of better assess our needs and meet our needs. If we can move on to the next slide. So food pantries is another phenomenal resource. So food pantries provide direct access to food and groceries for those in need. often relying on community donations and volunteer support. So food pantries play a crucial role in alleviating food insecurity among older adults in Massachusetts. Just a little data here. In 2023, approximately 1.9 million adults in the state, or 34% of households, experience food insecurity. That's a vast majority of our residents. Among these age 60 to 69, 10% face food insecurity. When you are dealing with a fixed income, increased cost of housing, especially when we're talking in relation to Massachusetts, how expensive cost of living has become, you need to access whatever resources are at your disposal to ensure that you are not having to compromise on whether you're spending your money on food or medication or housing. Those should all be accessible. How to find food pantries, resources such as community directories, social media, local government websites can assist individuals in locating nearby food pantries. And I'm going to have a list of resources at the end of my presentation, and we can progress on. So just to kind of cover, so financial planning for older adults facing food insecurity. Like I said, the best approach is to stack benefits. You can receive the Meals on Wheels program, you can apply for SNAP, and you can take advantage of food pantries. We also have programs like the Farmers Market program that's run through the Department of Agriculture, where older adults can, if they meet eligibility criteria, can get, this year is $50 to use towards any a farmer's market in their local area. Like I said, there's also programs like Bread of Life, emergency assistance. There are support hotlines for local food banks through Project Bread, which I'll have in my resource list. And like was mentioned earlier, there is through ASAPs, there is the money management program that can support older adults in trying to navigate trying times and figure out how you can meet all of your needs without putting yourself in financial duress. And if we can move on to the next slide. And this is just a list of other community resources. So Project Bread is a great resource because they do have a hotline. They can be called at any time of day, and they really can show you what is available in your service area. Greater Boston Food Bank of Western Mass. There's Merrimack Valley Food Bank, and also I've put the link to the Massachusetts Department of Transitional Assistance. But and we can move on to the next slide. But that is everything for me. Thank you guys so much for having me today.
Thank you, Carla. And I will note that all of these slides, I'm going to put them on my website, kateforrep.com, under the resources, so that all that this great information you all are providing and the contacts will be available, you know, in perpetuity for anyone who wants to go there and look more closely at them. So thank you so much. Let's turn now to our final presenter, Erin Nobles. Erin works as a trusts and estates attorney and is a partner at Modern Legacy Law Group in Melrose, Massachusetts. Erin is a member of the Boston Bar Association, the Women's Bar Association of Massachusetts, and the National Association of Elder Law Attorneys. And Erin, I'm really glad that you're going to be able to talk to us about how seniors can maintain control over their financial legacy, provide for themselves and their loved ones, and ensure that their healthcare and end-of-life decisions are honored. So thank you for being with us.
Absolutely. Thank you so much for having me. I'd like to thank you for hosting this conversation. And I have just learned so much from the other presenters today. It's been fantastic. As Rep. Kate said, I'm Erin Nobles. I'm a lawyer and a partner of Modern Legacy Law Group, where I focus my practice on helping clients think through the kind of legacy that they're going to leave behind through creating wills, trusts, guardianships, and other legal instruments. So before I get started, just the standard disclaimer that whatever I say today is not intended to be legal advice, but is intended for informational purposes. Anyone listening to this with legal questions, I would recommend that they consult with a lawyer. Massachusetts Legal Resources Finder might have some referrals to low-cost legal resources. They're available at masslrf.org. So, having got that out of the way, I'm starting my time by discussing an issue that is important to all of the clients I serve, no matter what stage of life they are in. And that is what we can do from a legal perspective to preserve our autonomy and our right to make decisions about our finances as we age. And that starts with having a power of attorney document in place. Then I'm going to talk a little bit about what can be done through the court system when a senior without a power of attorney becomes unable to handle their affairs and needs to have a conservator or a conservator appointed. Lastly, I'm going to touch on what are called filial responsibility laws and how they might apply in the Commonwealth. So in Massachusetts, there's a presumption that everyone 18 or older is qualified to make financial decisions on their own, and they're entitled to privacy in that decision making. A lot of my midlife clients are surprised when their kids turn 18 and suddenly they, the parents, can't stop them from applying for credit or signing a contract. But the legal presumption of capacity to manage our money is, I think, essential to the protection of our rights, especially as we age. And there may be circumstances where seniors, or any of us, might need some assistance handling our finances or personal affairs. Fortunately, it's possible to choose an agent, an individual in advance of your incapacity to help you through a written document called a power of attorney. We can go to the next slide. A power of attorney, an example of a power that might be granted in a written power of attorney might be the ability for your agent to write checks and sign them for you, or to speak to your landlord about a needed repair that they're required to provide according to your lease. A power of attorney can be broad and general, or it could be specific to a particular situation. Mass.gov is a great place, I think, to get information about the power of attorney and sample documents that might work for you that you can download. Next slide, please. So I'd like to talk about some different types of powers of attorney that might be appropriate for your situation. So one of the first questions that folks often have for me is, when should this document take effect? And you have the ability to create documents that are either what we call springing documents or documents that are immediately effective. A springing power of attorney is going to take effect only after a specific event occurs. And that specific event is typically you've lost the ability to make those sorts of financial decisions for yourself. This document usually requires at least one physician to certify that you are incapacitated. I don't typically recommend this document because it can be difficult to get a doctor to agree to sign something like this. And often when incapacity happens, it happens quickly, and you don't want to really sort of tie the hands of your agent in making those decisions. But if you're not comfortable with giving an immediate power, this could be the right decision for you. An immediate power of attorney is something that's going to take effect immediately after you execute it properly. And if it's a durable instrument, it will still be effective even if you become incapacitated. This is kind of the standard document, and honestly, I and most lawyers will say that it's going to be the most useful document to have. A power of attorney can either be what we call a general power of attorney or a limited power of attorney. A general power of attorney is going to provide broad authority to the person who you have chosen to act in a whole variety of circumstances. A limited power of attorney is going to give specific authority to do a particular act or acts. Limited power of attorney is frequently used by business owners. Or that could be used in a particular situation like transferring a car title through the RMV or working with the Department of Revenue to settle a claim. The fifth and final type of power of attorney is the medical power of attorney. This is more commonly known in Massachusetts as the healthcare proxy. And this allows the agent that you've chosen in advance to make medical decisions on your behalf based on their understanding of how you would want those decisions made, and only if you are incapacitated. So there's no immediate medical power of attorney that you can grant. It only becomes effective if your treating physician has examined you and determined that you either lack the ability to make or to communicate that decision. Next slide, please. So just generally, things to remember about the power of attorney. The power of attorney can help you continue your financial affairs in the way that you would want if you become disabled or incapacitated. A power of attorney can help avoid the expensive process of a conservatorship or a guardianship, which I'm going to talk about next. It's important to note that you can have at one time more than one power of attorney, each with different scopes of authority. For example, you might create a general power of attorney to handle your personal affairs. And if you're working, you might give a limited power of attorney to your office manager to sign checks while you're on a planned vacation. A couple other things I would note is that you can have the general power of attorney, but oftentimes your bank or another third party is going to have their own form that they prefer. Doesn't mean there's anything wrong with the one that you put together, but oftentimes a bank will have one that they prefer to use. So my recommendation to people is while you're creating these documents, you want to think about the places where you are regularly doing business, and you want to ask them if they have their own form that they'd like you to complete. Massachusetts does provide a lot of flexibility in creating a power of attorney, but there are specific legal requirements for a power of attorney to be valid. I think that a good resource that I like is honoringchoicesmass.com for basic information and sample forms. But again, always check with the lawyer if you have any questions. So one thing that's important to remember is a person can only create a power of attorney if they have sufficient mental capacity to understand the document's implications. So if a person lacks that capacity or there are questions about their capacity, they're not able to create a power of attorney. And that's why I think it's so important that everyone have this document in their arsenal, because you just never know. A power of attorney, in fact, can allow you to choose in advance the person who you would want to step in if you needed, if you just needed sort of blanket assistance with that. So, but working on the assumption, and we can go on to the next slide. Yeah, so working on the assumption that this was not done, that someone did not have a power of attorney in place and they lost capacity, what happens next? Well, the next legal step to take is to seek a conservatorship in the courts. So this is a legal process where a court will actually appoint someone to manage the financial affairs of someone who's unable to do it themselves. This could be, sometimes this is a minor. This could be somebody with a disability or someone with dementia. A conservator can either be completely or partly responsible for the financial affairs of the protected person. So again, paying bills, managing budgets, maintaining and selling property, including real estate. Conservators are appointed by the Massachusetts Probate and Family Court and have to regularly report to the court on the protected person's care and property. In order to apply for a conservatorship, an applicant needs to typically present a medical certificate to the court demonstrating the scope of the conservatorship that's needed. This can be a complicated process, and it is recommended that you hire an attorney as you're going through this. You can go on to the next slide. In Massachusetts, once a conservatorship is appointed, a permanent conservatorship will last until the protected person passes away or until the judge revokes the conservatorship. A temporary conservatorship typically lasts for 90 days with the possibility of a court-ordered extension. One thing to keep in mind is that a court will only approve the least restrictive option for the protected person. Again, mass.gov, great resource to learn more about that process. The last thing I'm going to touch on, next slide please, are filial responsibility laws. I get this question a lot. Clients will ask me, do I have a legal obligation to support my elderly parent? And the answer may be yes, under certain circumstances. In Massachusetts, filial responsibility laws may require adult children to financially support indigent parents under specific conditions. This is Massachusetts General Laws, Chapter 273, Section 20. And the language states that any person over 18 with sufficient means who unreasonably neglects or refuses to support a destitute parent residing in the Commonwealth, when such a parent is unable to sustain themselves due to old age, can face criminal legal consequences. So in a nutshell, if the parent cannot afford essential needs, healthcare, living expenses, and the adult child has the financial ability, they may be obligated to provide support. Failure to provide that support actually can result in a fine. I think we can move on to the next slide. Yes, okay. Failure to provide that support can result in a fine or maybe even imprisonment. But the devil is in the details here, and the law does not consider the neglect of a parent unreasonable if the parent didn't reasonably support the child during their own minority, or if the child has made a proper and reasonable contribution towards the parent. So what I'll say about this is that filial responsibility laws are in place in about half of the states in the United States. They are rarely enforced. And in fact, I was not able to find a single successful prosecution in Massachusetts. But as baby boomers move into retirement in large numbers, the need for care increases. We were talking about the expenses of some of that care. We may start to see these types of laws being enforced more frequently. Last thing I was going to say is that as a somewhat related matter, children usually are not responsible for a parent's debt after they pass away unless they were joint account holders or they had agreed to co-sign some sort of obligation. Instead, these debts are going to become the responsibility of the deceased parent's estate. So I would urge everyone over the age of 18 to create a general durable power of attorney. There are a lot of free or low-cost resources available online. Asking for help from a lawyer can always be beneficial because sometimes you don't recognize the complexity of your own situation until you're in it, but you're not required to hire an attorney to put these documents into place. I hope that this was helpful. Most lawyers will offer some sort of a free consultation. We certainly do. And it's important to feel comfortable with the lawyer that you're working for or working with, certainly before you pay them anything. Thanks again to everyone on the panel today. I've really enjoyed this.
Well, thank you, Erin, for rounding us out. That was really useful information. And I want to thank all the panelists. Before we close, I just want to make sure if any of the other presentations that you heard today caused you to remember something else you'd want to raise or add to this discussion, say so now, or of course, you can share out information in other venues moving forward.
Yeah, first, I just want to thank Rep. Kate for putting this event together. Really appreciative. I learned a lot today from the other panelists, and I definitely am very interested in reaching out to some of you because I think there's some room for collaboration on how we can provide more resources with the demographics that you guys work with. I just wanted to mention, along with the Enrich Platforms self-paced financial literacy courses, OEE also offers tailored financial workshops for those who can organize community groups. So these workshops can be available in person or virtually, and they're designed specifically for older adults and cover a range of topics from scam and fraud protection to retirement planning, ensuring that we meet the financial education needs. So feel free to reach out to me if you or anyone else in your community is interested. Thank you.
Thank you, Michael, for raising that up. Anyone else?
Yeah, I would just like to add, we know definitely working in the field that navigating these services can be overwhelming. It's a lot to take in. So I really want to encourage anyone who's watched today to reach out to an ASAP, a Council on Aging. There are people out there who can support you and navigate this process. And I think oftentimes we don't really reach out for support until we're in the thick of it. And I really would encourage older adults to, before you're even considering receiving any supports in your home, reach out to your local ASAP. There are options counselors who can just review what supports and services are out there, so you're well informed before you come to a point where you need that kind of support. Really, self-advocacy and giving yourself all of the information that you can to be as well informed about the decisions you have to make moving forward through aging. And there are people there to help you. So reach out to us. And I think on the mass.gov website, you can type in your area code to find out who your local ASAP is. And thank you to Kate for having us today.
Thank you, Carla. All right. Well, I want to thank each of our esteemed presenters. I certainly learned a lot as well, and I'm so glad to have connected you all for this really important conversation. Viewers can contact our offices for assistance or additional information, and as Carla said, you're encouraged to do so. On my website, I will have a resource page listing the different supports that you or someone you know might find helpful, and we'll add these slides to that page. This recording also will remain available on my YouTube channel, where you can find all community conversation events. So thank you so much for watching and joining us today, and please be well.